My name is Tammy and I'm a patient of Dr. Al Alley. About almost 4 years ago, I had the gastric sleeve done and I lost almost 100 pounds. I was proud of the weight I lost, but I wasn't pleased with how I still looked. I'd done a lot of research, found some doctors that I called, made some consultations with. I did have a breast lift done a year ago, January, and I spoke with that doctor about a tummy tuck or what options we had to get rid of what I still had left, the loose skin. And he said that he would do a tummy tuck, but he would only do the front in one procedure and he could do the back in another procedure. And then my arms, we talked about a brachioplasty on my arms. He would do that in another procedure. And he wouldn't do a whole lot at one time. So he had recommended Dr. Ollie. He had taken some seminars with him and knew that he was a very good, highly recommended doctor. I called Dr. Ollie, made a consultation. He was very upfront and honest with me. He told me that I could go through with a tummy tuck, but I wouldn't be happy with it. He said, you won't be happy with the results. He said, due to being morbidly obese for so many years, because I was at almost 300 pounds at one point in my life, and had 2 children, he said that there was some muscle damage. There was a lot of things that dropped that needed to be lifted back up where they belonged. And he had showed me some before and after pictures of some patients that looked similar to me. He recommended the belt lipectomy, which went all the way around. It was a complete lower body lift. And he said he could do that in one procedure. And then we could go back and do an upper body lift or just the brachioplasty in a second procedure, and I could get more of the results I was looking for in 2 surgeries instead of 4 or 5. So I did schedule with him. Last October, I did the belt lipectomy. The results were wonderful. I told Dr. Ollie I would probably never be in a bikini, and I have bought 4 bikinis just this year. He did my upper body lift and brachioplasty in February of this year. The scars are fading really well. They look amazing, and I get compliments all the time at how well I look. I recommend Dr. Ollie to anybody that's looking for plastic surgery. He's very friendly. He takes care of his patients himself. He's one of the only doctors that I have ever dealt with that I've had his cell phone number. I came from Oklahoma to Dallas to see Dr. Ollie, and he hated the fact that I had to make the drive. He always offered to do phone visits, but I wanted the one-on-one. I wanted him to see what I saw through his eyes to make sure that there weren't going to be any complications. And I would come in, he always worked me in. I never sat in the waiting room for more than 10 minutes to see him. When I got back to a room, I was never back there for more than 10 or 15 minutes unless he worked me in. I think the longest I ever had to wait for him was about 20, 25 minutes. It was well worth the wait. Losing the weight wasn't as difficult as I thought it would be, and I wanted to lose it slow because I was hoping that my skin would elastic back, but it didn't. I still had quite a bit of loose skin. Due to my age, that's probably had something to do with it too. I knew it was something I had to do for myself. Well, he said that there was a lot of muscle damage. He said he did major muscle repair. He said that if you looked inside my body, he said it looked like I had 450 to 500 stitches. He said in all reality, it was probably closer to 350. He said, but there was major muscle damage. In my consultation, he asked me to suck my gut in, and I couldn't. You couldn't tell I was even attempting it. He said my belly button wasn't even attached anymore. It was attached to blood flow, and he was able to save it, but he said it was just in there floating. And so I got to keep my belly button. I was really persistent that I left surgery with the belly button. I didn't want to not have one. He said, you will have one. And I do, and it's perfect. I've recovered very well. I did stay the night in the hospital for each procedure for one night, just because I lived so far away, and he wanted to make sure there were no complications and no issues. The lower body's been about 8 months out, and like the back side is very, very faint. Unless you know I've had the surgery and you know what you're looking at, it really doesn't stand out. And Dr. Ollie told me, he said, you either have to learn to live with the skin or you have to learn to live with the scars. Either way, I would rather live with the scars than trying to cover up all the flabby skin and that kind of stuff. I took the option of I'll live with the scars. And I'm glad I did. Dr. Ollie doesn't believe in narcotics. He does a lot of muscle relaxers because the muscles, I guess, is what he's focusing on. He does send home a few narcotics, and I took him for a couple of days just to sleep at night because it is hard. You have to sleep in a recliner in an upright position. It does make it a little more challenging. And I'm a belly sleeper, so that was a big adjustment for me. I only had to take the narcotics for a couple of days, but I did take the muscle relaxers as he prescribed them, for the length that he wanted them taken. He put me on water pills to keep keep the swelling down. The compression garments weren't really even that uncomfortable. I did those as he wanted me to. I have an office job, so I sit at a desk. I was off work for both procedures for about 3 to 4 weeks. So when he got the drain tube out and I could just put a Band-Aid over it, then I went back to work. We go to the lake. I can wear my shorts, my tank tops. I'm not trying to cover up. I don't have to buy a size bigger to get it bigger in the arms or bigger in the legs, or I feel good about myself. Well, I'm very happy with the way I look. I can look in the mirror now and I do see a lot of improvements, and that hard work of losing that weight has made me feel better about myself and more determined to keep the weight off. I've struggled with my weight probably since after I gave birth to my first child, who was born in '96. I just steadily continued to gain weight. I tried the Plexus, I tried the True Vision, I tried Adkin. I tried every diet out there. I went on diet pills, I did over the counter, I did prescription, and I could lose the weight. I could lose 20, 30, 35, 40 pounds. But I wasn't willing to take that lifestyle change and just go with it. I couldn't be on diet pills forever. I felt like I couldn't eat no carbs forever. And my gastric surgeon, he didn't want me to go with no carbs. He said, it's not healthy, your body needs carbs. I was tired all the time. I didn't want to do anything with my family. My kids were getting older and they had ball games and places they wanted mom to be at, and mom didn't want to be there. When my son was a senior in high school, I weighed 280 pounds. It devastated me that it took everything I had to go to any of his football games and school functions, and I just decided that it was time to do something. I did the proportion TV dinners like Weight Watchers, NutraSweet, and I wanted to eat 2 or 3 of them. Well, it was pointless to buy that if you were going to eat 3 of them in one setting. So I thought, well, if I have the gastric sleeve and I have that portion of my stomach cut out, then I don't want that food, and I felt full and satisfied. And I did, and it's a struggle. A lot of people think the gastric sleeve is an easy way out. It's not. I still have to watch what I eat. Granted, I can only eat a certain amount, but I still, if I eat a lot of junk or, high carbs, I can pick the weight up. I can pick up a pound a day. But obesity runs in my family. It's not an excuse. It's just a life change that I have to live with and find a way to deal with it. My mom lost her sister at the age of 42. She was very overweight, had a heart attack. I lost my uncle, another one of my mom's siblings, obesity. He was over 450 pounds. So, I watched my family fight. My mom has done aerobics and done all these diets and to try to maintain her weight. And she's overweight and it's been a struggle her whole life. And I didn't want that struggle. I just have to watch what I eat. And I've worked so hard to get where I am today. It'll be easier to maintain and lose. I want to lose another 10 or 15 pounds. I can wear tank tops and feel comfortable about it. I can go to the gym and my skin's not slapping and in my way. And to me, it was embarrassing. I felt like I was at the gym working out and I still had skin flapping and I was making noises and I felt like people were staring at me. And now I can go and get on the treadmill and I can run on the treadmill or do whatever I want. And I feel like I fit in more with the people at the gym. I went to the gym for months after I had the gastric surgery and I just didn't see the results. But my arms were this big around and you couldn't see any biceps or triceps no matter. And I was lifting probably 60 to 75 pounds from my upper body and I just couldn't tell a difference. I could feel the soreness, but I just couldn't tell a difference because there was so much excessive skin. And now I feel like when I go to the gym, I'm seeing results. I'm seeing that muscle build. The skin's out of the way. The muscles are back where they need to be. And I feel like there's something I'm working towards. I wish I would have done it years ago and I wish I would have met Dr. Ollie a long time ago. And I would have had this done a long time ago. You're an awesome doctor, and if I had it to do all over again, I would definitely have it done here.